what happens when an unstoppable biological threat meets a healthcare system run by people who, well, actively punish intelligence?
I mean, it sounds like the setup for a dystopian movie, honestly.
Right. But welcome to the deep dive. Because today we are looking at a stack of sources that they're deeply critical, sometimes pretty bleak, and they paint a terrifying picture of our medical future.
Yeah, it's a heavy stack today.
Very heavy. Our mission today is to connect some seemingly unrelated dots. We've got historical critiques of the UK's National Health Service, or the NHS. We've got medical manifestos declaring we are in the post-antibiotic era.
Which is terrifying all on its own.
Exactly. Plus a breakdown of John D. Rockefeller's influence on modern medicine and like a genuinely fascinating philosophical analysis of Machiavelli.
It's quite the mix.
It is, but I do want to make a quick disclaimer right up front. These sources contain heavy critiques of government institutions, modern medicine, and some politically charged observations about societal decay. Like, there are some pretty grim depictions of what London might look like in 2025.
Right, and we should be clear, we're not endorsing those specific political viewpoints.
No, not at all. We are not taking any political sides here. Our job is just to impartially unpack the fascinating and frankly alarming arguments presented in these materials.
Absolutely, just following the threads they've laid out.
Exactly. So, okay, let's unpack this. The sources keep referring to systems being run by stupid people. But what do we actually mean by that? Because I assume we aren't just talking about low IQ scores.
No, not at all. And that's where the video analyzing Machiavelli comes in. It completely redefines the concept. In institutional terms, stupidity isn't a lack of intelligence. It's a structural feature.
Okay, structural feature. How so?
Well, it's an environment that actively elevates thoughtless obedience over critical thinking. The presenter actually outlines 7 specific rules for why stupid people rule these massive bureaucracies.
7 rules. Okay, I want to go through these because they form the whole foundation of the argument. What's the first one?
So, rule 1 is that power rewards the appearance of certainty, not intelligence.
Ah, meaning like intelligent people see nuance and doubt.
Exactly. Intelligent people see complexity, which leads to doubt and careful testing. But bureaucracies, they hate doubt. Fools project absolute confidence, and systems reward that.
Wow, okay. That makes a lot of sense. What's rule 2?
Rule 2 is that obedience requires not thinking. Basically, systems like massive bureaucracies filter out people who ask why.
Right, they just want you to follow the flowchart.
Exactly. Which leads into rule 3. Groups punish independent thought. Conformity is seen as the highest social virtue. If you question the group, you threaten to fracture it.
So you get pushed out.
Yeah. And rule 4 is that stupid people are easy to use.
Oh, that's harsh. But I guess, intelligent people resist manipulation, right?
Right. If you think critically, you push back. Thoughtless people just execute the orders without resistance, which ties perfectly into rule 5. Intelligence is punished, stupidity is rewarded.
Wait, punished?
Yeah, because exceptional people threaten average people. The culture evolves to protect mediocrity.
That is... wow. Okay.
And rule 6 is that stupid people are loyal. Think about it. Highly capable people have options. They have leverage. That makes them a threat to a rigid system.
Right, because they can just leave and get another job.
Exactly. But mediocre people are entirely dependent on the system. They have nowhere else to go, which makes them ferociously loyal and highly political.
That is so cynical, but it tracks. And the last rule?
Rule 7. Systems want to be maintained. People who are rewarded by a broken system physically cannot see that it's broken. They act like immune cells against reform.
Okay, but I have to push back here gently. Looking at the Guardian data from our sources, is it really fair to call healthcare leaders stupid? They are dealing with a £50 billion hole every year, just managing the effects of poverty and deprivation.
Oh, for sure. The funding crisis is massive.
Right. So isn't this just a societal failure rather than the administrators being Machiavellian fools?
Well, the sources don't deny the funding issue, but they connect these 7 rules directly to the cult-like worship of the NHS.
The Institute of Economic Affairs video talks about this, right?
Yes, the IEA video.
Right.
It points out that the NHS is treated almost like a religion in the UK. It's framed as this expression of national selflessness.
Like, you can't criticize it without being a heretic.
Exactly. But if you look at the actual data, the system ranks 9th out of 11 comparable countries in healthcare outcomes. And it's 23rd globally in access.
Wait, 23rd? That is not great.
Not at all. But because the system demands blind loyalty, that's Rule 6, and punishes independent thought, Rule 3, It literally cannot reform itself. It just demands more money to fuel the exact same failing structure.
Okay, so a rigid bureaucratic system might survive during normal times, just sort of limping along. But what happens when the actual foundation of modern medicine starts to crack?
And that is the catalyst for the collapse the sources are warning about. But to understand it, we have to look at how modern medicine was built. The sources trace it back to what they call Rockefeller medicine.
Right, John D. Rockefeller, early 20th century.
Yeah. Basically, healthcare used to be highly pluralistic. You had holistic practitioners, homeopaths, naturopaths, alongside traditional doctors.
But Rockefeller changed that.
He did. He had massive interest in the petrochemical industry, and he heavily funded medical schools on one strict condition. They had to adopt an allopathic curriculum.
Meaning a focus entirely on synthetic drugs, chemical dependency, and centralized licensing.
Right. It shifted medicine from supporting the body's ecosystem to viewing the body as a machine that just needs a patented chemical pill when a symptom pops up.
And the sources argue this conditioned the public into a state of learned helplessness.
Exactly. You don't think about your lifestyle. You just hand your body over to the institution and expect a pill.
And, that model worked like absolute magic for a long time. The discovery of penicillin alone changed everything.
It did. But biology adapts. Which brings us to the crisis detailed in Dr. Srivatsa's writings.
Yes, this part is terrifying. So the CDC declared in 2019 that we have officially entered the post-antibiotic era.
The miracle drugs are failing.
They really are. We're seeing these superbugs like MRSA and this fungus, Candida auris. I hope I'm saying that right.
Yeah, Candida auris.
Right, and they are literally colonizing hospitals. But here is where the systemic stupidity really shows up. Instead of careful diagnosis, the UK government, starting around 2006, allowed nurses with just 26 days of classroom training to prescribe antibiotics.
26 days. It's unbelievable.
They just gave them rigid, nice guidelines and algorithms to follow. So here's where it gets really interesting to me. It's like we've been using a sledgehammer to swat flies for decades, right?
Right.
And now the flies have evolved to actually eat the sledgehammer.
That's a great way to put it.
And the system's response is just to hand the sledgehammer to people with even less training.
Exactly. Because remember, Rule 2, obedience requires not thinking. A massive system like NHS 111 needs operators who just follow the flowchart.
So if a patient calls with a cough,
The operator looks at the screen. If the branches say prescribe antibiotics, they do it, even for viral infections like the flu or a common cold.
which antibiotics physically cannot cure?
They can't. But this thoughtless adherence to protocol is actively training the bacteria to mutate. It's creating the superbugs that are currently killing 44,000 people a year from sepsis in the UK alone.
44,000. That is a staggering number. But if the impending disaster is so obvious, why didn't anyone inside the system pull the fire alarm? Like, doctors had to know this was happening.
They did know, and some did pull the alarm. This is where we get the story of Dr. Kadiyali Srivatsa. He was a whistleblower.
Okay, tell me about him.
So he saw what this algorithmic prescribing was doing. Years prior, he'd actually developed a logical triage methodology. It was called the Pediatric Assessment Tool, which eventually evolved into a system called MAY.
And he tried to use this to stop the pilot nurse-led practices from blindly prescribing.
Exactly. He gathered clinical evidence and took it straight to the General Medical Council, the GMC, and the NHS.
He showed them the data.
Hard data, showing that these flowchart diagnoses were leading to severe complications and preventable deaths.
So this is textbook Machiavelli Rule 5 intelligence is punished, and Rule 7 systems want to be maintained.
Spot on. Instead of looking at his data and fixing the problem, the NHS and the GMC completely turned on him.
The sources say they ostracized him. They imposed punitive sanctions that forced him into bankruptcy.
They even subjected him to psychiatric evaluations.
Wait, really? Psychiatric evaluations?
Yes, it's a classic bureaucratic move. If you can't refute the whistleblower's data, you discredit their sanity.
That is chilling. And he wasn't the only one, right? The sources mention a pretty tragic scale to all this.
Yeah, it's sobering. Over 100 doctors committed suicide over a decade due to these endless, punitive sanctions by the GMC for questioning the status quo.
Over 100.
Yeah, the system literally eliminated the intelligent people who tried to fix it. It ground them down until they broke.
It's just devastating. But Dr. Srivatsa didn't just give up. I mean, he took his methodology, realized the human bureaucracy was impenetrable, and bypassed it completely.
He integrated his life's work into AI.
Which brings us to the urgent pitch in these sources. The introduction of Dr. Maya AI and its ChatGPT integration, Dr. Maya GPT. This is framed as the ultimate workaround to a broken system.
Right. Because if the humans in charge are operating under the rules of stupidity, you have to remove the humans from the initial gatekeeping process.
So how does Dr. Maya AI actually work? How is it different from the NHS 111 flowcharts?
Well, NHS 111 is a static if X, then Y tree. Dr. Maya AI uses a simple, color-coded symptom system based on what the texts call conscious presence.
Conscious presence, what does that mean practically?
It means it's built on natural intelligence and 40 years of actual clinical acumen. It listens to the timeline and nuance of the
It
symptoms.
really gives you a color code.
Yeah. Red means see a doctor immediately. Blue means you likely have something contagious, so isolate at home and call an ambulance. Green and yellow mean you can self-care or go to a chemist.
And the accuracy rate on this is wild, right?
98% diagnostic accuracy in differentiating minor from severe conditions.
Wow. So what does this all mean for you, the listener? It's basically an automated air traffic controller for sick people.
That's a great analogy.
Right. It keeps the contaminated planes, the infectious patients, from landing at the main hospital airport and infecting everyone in the terminal.
Exactly. The goal is isolation and correct routing. And the sources synthesize a very blunt, direct argument to the leadership maintaining the status quo.
Okay, if you were the advisor delivering this message to these stupid leaders, what is the pitch?
The pitch is an ultimatum. First, the post-antibiotic reality. You absolutely cannot use a 20th century telephone triage system for a 21st century superbug crisis.
Period.
Period. Second, the danger of hospitals. By forcing sick, contagious people to wait in A&E or local clinics just to get a basic diagnosis, you are actively turning hospitals into superbug breeding grounds.
You're facilitating the spread.
Yes. Third, the financial reality.
Mm-hmm.
You're spending £50 billion on the effects of deprivation, and you're wasting precious resources on unnecessary consultations for minor viral ailments.
So what is the solution?
The solution is you must use Dr. Maya AI as the mandatory gatekeeper.
Because it identifies infected individuals while they are still at home?
Right. It enforces isolation. It alerts doctors to local clusters to prevent pandemics before they start. And most importantly, it completely stops the unnecessary prescription of antibiotics by untrained staff.
It saves the failing miracle drugs for when we actually need them.
Exactly. The math presented suggests this is the only systemic way to reduce demand by 60% and survive the post-antibiotic era.
A 60% reduction in demand. It's just marveling how this AI shifts the power away from the bureaucratic herd and hands it directly back to the individual.
It really does.
Which brings us to the ultimate takeaway for you listening to this deep dive. This isn't just about the NHS or the UK government. It's about reclaiming your own free will in healthcare.
That's the core message.
Right. The sources are urging you, the individual, to learn the art of self-diagnosis, to understand the severity of your own symptoms using intelligent tools so you aren't blindly reliant on a thoughtless algorithmic system that might just prescribe you a drug you don't need.
You stop being a passive participant in a broken machine.
Exactly. Take back your agency.
And that leaves us with a final, really profound thought to mull over.
Let's hear it.
If Machiavelli's rules dictate that large human institutions will always, inevitably, optimize for blind obedience over intelligent adaptation,
Yeah.
is the true promise of AI not just to process massive amounts of data, but to serve as an incorruptible, independent thinker?
Oh, wow.
Right. A system that can simply bypass human institutional stupidity entirely.
Because it can't be bullied by office politics.
Exactly. Can't be silenced by medical counsel.
That is a fascinating thought. When human institutions punish the intelligence trying to save them, maybe a machine is the only thing that can bypass the ego and just fix the problem.
Something to think about.
Definitely. Thank you so much for joining us on this deep dive. Stay curious, trust your own intelligence, and keep questioning the systems around you.